I want to talk a little bit about Parkinson's disease right now, because if you or somebody you know has it, you may notice soon some commercials start popping up for a new medication that's designed to treat psychosis in Parkinson's disease patients. But it's a little bit of a good news, bad news thing. The good news is it does treat that, but we're just a little worried that you might get a little bit of a misrepresentation from that commercial as to how likely psychosis is in Parkinson's. Now, joining me to talk about that, I am happy to have Dr. Tony DeMarcaida from the Chase Family Movement Disorders Center, a part of Hartford Healthcare. They're based in Vernon. Doctor, thank you so much for joining me today.
Thank you very much for having me, Tim. April is Parkinson's Awareness Month, so I really appreciate the opportunity to talk more about Parkinson's disease today.
And while we only have a couple of minutes here today, you also have a symposium that's happening, I believe, on Saturday. Why don't we start by talking about that?
Thank you very much. Yes, there is the annual American Parkinson's Disease Association Symposium this Saturday, 9:30 to 2:30. You can still sign up for that. And we're going to have speakers from New York City, Washington, D.C., talking all about Parkinson's.
Where is it happening?
It's happening at Hartford Hospital at the Ublin Hall.
Okay, so that's one place where you can go to get a lot of in-depth stuff. But yes, talking about psychosis, it's one of the neuropsychiatric side effects, not side effect isn't the right word, but some of the things that can happen, the symptoms with Parkinson's disease, which might be surprising to a lot of people who just think of it as a problem with tremors. So how likely is psychosis? How prevalent?
So psychosis in general is coded to be about 50% of people with Parkinson's disease. However, the visual hallucinations, that is the most frightening symptom that people think about when they think about psychosis, only occurs in about 20 to 30% of people.
Okay.
When you were talking about the medication that was FDA approved for treatment of psychosis, you were talking about Nuplazid, which does work for this particular problem.
That is good. But you were a little worried, because the reason why we're talking about it now, albeit because it was FDA approved a couple of years ago, is because we're starting to see some commercials for it now. You just didn't want people to be overly worried.
That's right. And that was one of the things that I was hearing from my patients. As you mentioned earlier, Tim, Parkinson's disease is thought about as a motor symptom.
Yeah.
So when they saw the announcements about the medication talking about hallucinations and delusions, a lot of our patients were frightened by that. And we wanted to make it clear that psychosis is still occurring in the minority of patients who have Parkinson's disease, more like 20 to 30% with the hallucinations.
And nothing against Nuplazid. Does it appear to be a fairly effective treatment for that?
It is a wonderful drug to have, because it's the only medication that does not worsen Parkinson's disease.
Right.
The challenge of treating psychosis in Parkinson's disease is a lot of the medications treated psychosis makes Parkinson's worse.
Really?
So the other message that we're trying to get out to patients is that if they develop hallucinations, say they're in the hospital, they're very sick, they start seeing things, they must not, absolutely not take any of the other medications that are available for treating this, except for Nuplazid and a couple of others that are specifically designed to treat Parkinson's disease psychosis.
Are there any other symptoms that are either cognitive or neuropsychiatric that people might not be aware of?
Thank you very much. Yes, we are recognizing more and more that there are all of these neuropsychiatric symptoms in Parkinson's disease. Depression is very common and must be treated. Some people have cognitive impairments, some degree of dementia. Again, not the majority, but it can happen.
Okay, and once again, if you need to know more, there is the Advanced Parkinson's Disease Symposium happening Saturday right at Hartford Hospital. Hopefully that will be a great resource for you or somebody you love if they're suffering from Parkinson's. Doctor?
It's the APDA, American Parkinson's Disease Association, but thank you.
Okay, thank you so much, Doctor. Glad to have you on the show. Thank you. A lot we got in very quickly, so I'm happy about that. Okay, Audrey, let's send it out to you right now.
And such important information, guys. Thanks so much.